Ontario and Manitoba have announced that they will soon start collecting race-based data on the spread of coronavirus. It's a move many medical experts have been pushing for. In the U.S., there is race-based data. Where it's collected, evidence shows that African Americans are among the hardest hit by the virus. A recent study found in counties in the U.S. with the highest proportions of Black Americans represented more than half of all COVID-19 cases and deaths. As of mid-April, there were over 283,000 coronavirus cases in disproportionately Black counties and nearly 13,000 deaths. Those counties make up nearly 22% of the total. By comparison, all other counties had about 263,000 cases, just over 8,800 deaths. Well, officials say that the data collected in these regions is helping to create policies that these communities with them in mind. So, how could similar data help racialized groups here in Canada? Joined by Dr. Kwame Mackenzie. Now, he is the CEO of the Wellesley Institute, and that works to improve health and health equity in the GTA. He's also the Director of Health Equity at the Centre for Addiction and Mental Health. Dr. Mackenzie, thanks so much for joining us. You wrote an opinion piece back in March about the need to consider equity in the response to coronavirus. And let's look at Canada's response and how you'd rate it so far.
Well, I think so far in Canada's response, we haven't really considered equity as well as we could. Part of that is because we haven't had the right data. We haven't had disaggregated data. And because of that, we've been using an awful phrase, we've been playing whack-a-mole. We've been waiting to see where corona's been popping up, and then we've been trying to deal with that, whether it be long-term care homes, whether it's a homeless population, whether it is congregate living, like people with mental health problems, or now, whether we're starting to look at racialized populations. But some of these were a bit predictable, but some of these, if we had the right data, we'd have maybe understood that this was a problem earlier on.
Well, in the U.S., they've been collecting numbers that shows that coronavirus has killed Black Americans at a disproportionate rate, Hispanic Americans as well. Do you suspect that if we were collecting data here, we'd see similar results?
Yes, I do. As you say, in the US, they've found that African Americans have got double the risk of coronavirus getting infected and also deaths. In the UK, they've also found that Black and ethnic minority groups have double the risk of getting COVID-19, and 68% of the health service workers who've died have been from Black and ethnic minority groups, and all of the doctors who died in the UK have been from Black and ethnic minority groups. But we don't only have to look at other countries. If we look at what happened during H1N1, that influenza epidemic in Ontario, we found that South and East Asian populations were more likely to get coronavirus, between 2 and 6 times more likely to get coronavirus. But the Black population in Ontario was nearly 10 times more likely, to get H1N1, not a coronavirus. And so we've seen in the H1N1 epidemic that there were racial differences in the percentage of people getting infected. So we've got actual data from Canada from the last infection. We've got data from internationally on the current pandemic, and that should really make us start looking at these different populations.
There's a lot to try to understand in all of this, but help us to understand, what could the contributory factors be? Is it existing conditions? Is it socioeconomic? Is it lack of health care? What do you think is causing that disparate numbers that we're seeing seemingly all over the Western world?
Well, I think that it's a lot of the factors that you've already mentioned. What COVID-19 is very good at is exacerbating existing disparities in health between groups. So where there are sort of differences in access to healthcare, differences in rates of illness, differences in rates of social care and supports, COVID-19 is making it worse. Where there are people who are poorer where there are people with sort of living in more overcrowded conditions and therefore finding it more difficult to physical distance, coronavirus is showing is getting in and making a difference. And so I think, yes, there are all of these pre-existing factors that are being exacerbated by COVID-19, but there may be other factors that we don't know about, and that's why collecting data and actually trying to do the research is so important. In the UK, they have found that people of African and Caribbean origin are 2 times more likely to get coronavirus, even when they've taken into account all of the socio-demographic factors, that, such as income, all the things they thought were the cause. And so there's something else going on. We don't know exactly what it is. It could be that the messages that are getting out about social distancing, or even the capacity to social distance, isn't as possible in lower income populations. We don't know exactly. And so once we get the data, we start analysing the data, we start working with communities, we'll be able to come out with some innovative solutions that can really make a change and save some lives.
When this does all end, hopefully we will have some answers, and in the future we'll continue to have the information to make decisions about. Dr. Mackenzie, thank you so much. Appreciate your time.
Thanks very much, John. Bye-bye.
Thank you. Dr. Kwan Mackenzie is a CEO of the Wellesley Institute.